Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. Today, we will be talking about recent guidance updates on COVID-19 boosters, temporary nurse aides, and for our Pennsylvania listeners, the DOH Therapeutics form. Everyone will be on mute, but if you have any questions, please enter them into the chat and we will address them in the discussion at the end of our webinar. We encourage you to join us every Wednesday at 2 p.m. for more webinars in this series. Next week, we will be talking about the CDC's guidance on pneumococcal vaccines. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. And now I would like to introduce our guest today, Penny Imes. Penny is a quality improvement specialist at Quality Insights. She started her nursing career in acute care before moving into long-term care. Her positions in long-term care have included staff development, dementia unit manager, registered nurse assessment coordinator, and director of nursing. She found the perfect combination for herself at Quality Insights, where she is able to work in quality improvement with long-term care nursing homes. So Penny, welcome, and thank you for joining us today to get us up to speed on these recent updates. And if you're ready, you can take it away.
Yes, hi. Thanks, Kathy, and I'm glad to see some participants here today to cover some of these updates. I know we had a previous webinar where we did discuss the temporary nurse aid requirements, but we've moved further along in time. And so it's always good to, I think, give some updates just to reinforce what we may have talked about, to make sure that there aren't any new, there's not new information that you might need. And I know in Pennsylvania with our Pennsylvania Department of Health message board, I always want to make sure that our participants, our providers are making sure that they're checking that on a at least weekly basis and pulling off the information that's there, because we give you a lot of the CMS guidance. And then I know Pennsylvania will usually take a look at CMS guidance and then pull some of that out. So some of what I'm talking about is more specific for the for the Pennsylvania homes with the PA Department of Health message board. I will be asking, if there's some West Virginia nursing homes attending today. Also, I'll be asking some questions for you to put into chat for me, some answers about what you might use in West Virginia, whether it's a little bit different. And I'm also going to, as I'm going through this, Kathy will be putting up some links so that you will have them in place. But again, if you go to the Department of Health message board, all of this information is there and you want to make sure that you have it. So to get back to that temporary nurse aid training, and of course that was on April 7th. And so hard to believe how fast time has gone, but on April 7th, we learned that was when the CMS memo went out that talked about that temporary emergency waiver for the training and certification of nurse aides was going to be terminated in 60 days. And so what that meant is that Pennsylvania, or actually all states, would no longer be allowed to hire temporary nurse aides after June 6th due to the expiration of the CMS waiver. And so that time frame has come and gone. The information there is for Pennsylvania, and if anybody from West Virginia has a different system and they want to chat that in, that would be great. Our state uses Credentia for our nurse aid testing. So the message from Pennsylvania was, yes, follow the CMS guideline. You cannot, that waiver went away. You cannot hire temporary nurse aides after June 6th. And by October 6th, all temporary nurse aides must successfully pass the skills and written portions of a state nurse aid exam. So we have those, and those timeframes were part of the CMS memo, but we want to reinforce those. And then there are any temporary nurse aides who don't pass that nurse aid exam by October 6th. they cannot continue to perform the duties of a nurse aide. They have to stop working as a TNA until they do pass that exam. Now, of course, they'll have 24 months from October 6th and 3 attempts to pass both parts of the exam, but they cannot work as a nurse aide until they pass that exam and are added to the registry. And one of the things that all of you as providers with your staff need to be looking at and working on right now related to this is strongly encourage that you go ahead, your TNAs go in and they create that profile in the Credentia system. And what that does is that's completing and submitting an application to test. There are attestation forms that they need to complete. So you want to make sure that they're working on that, getting that done now. You don't want anybody to wait till the last minute. We know what staffing issues are out there. And if you have temporary nurse aides that you want to keep, you really want to work on encouraging them to, get started and assist them with moving through this process so that they are able to get the testing done in this time frame. Because as we all know, with the testing sites, there's usually a backlog of all of that too. So it's very important that you get started. And again, I'll reinforce what I had said before, that you really want to make sure that you as a facility have documentation in place, and also that your temporary nurse aides have documentation in place to show what they did, when they did it, and the efforts that they're making to move forward with becoming certified nursing assistants. And then just sort of as a reminder, the training that they have to take, their Credentia has provided an online review of a skills exam to help the temporary nurse aides prepare for the testing. And that's the link, credentia.com/testtakers.pa that Kathy's putting up in the chat for you. And there's a lot of helpful resources there to answer questions, help people prepare for taking tests, which I know for a lot of people, even if they have the skills, sometimes taking tests causes a fear or some anxiety, and any resources, any help that they can get to be prepared for the testing, I think it's really important. And so that's in there. So as I said, those websites, there's also, you can check out pa.gov, Department of Education website. And I think Kathy will be posting that link if she didn't already, that you can go to. And if you put under search temporary nurse aide, it will pull up a lot of resources for you, information. I know after the last webinar, when we first presented this about the waiver going away, I had a couple nursing homes reach out to me, and I gave them that Department of Education website, and they found it very helpful. There's a lot of great resources on there. So if you have any questions or concerns, that's another place where you can go for answers. And like I said, a lot of resources, it'll answer a lot of your questions. At the end of the presentation, so if you have any questions about this portion with the temporary nurse aide requirements, I'll be checking with you towards the end of the webinar to see if you do have any questions. So that's really, one of the other things I did want to mention with the Pennsylvania Department of Health, I almost forgot this, but they are inviting the skilled nursing facilities to participate in a voluntary survey that will help them determine the total number of temporary nurse aides that are working in facilities and how many still need to be tested. And that survey is hosted by Credentia, so you'll be able to find that there on their website, that survey on their website. And it really is important, I think, to share that information, because when you participate in a survey like that, that allows Department of Health to actually really know and see, again, from your viewpoint, what's happening. Is the testing available? how are your temporary nurse aides moving forward with completing their testing? And I just think it's something that's really helpful. Sometimes, the more information you can share with other people, the more they understand what you're going through right now with trying to get that taken care of. Then the other thing that's come up, we have been talking about, of course, boosters. So we're moving from the temporary nurse aid training over to boosters. And the reason we wanted to update you on that is, I believe the last time we talked, there was CDC had very much suggested, strongly recommended that those who were 50 and older really should try to receive a second additional booster at least 4 months after the completion of their first booster dose. And so our Department of Health is also now there. The research does show, according to recent CDC data, that for individuals, especially age 65 and older, which is, the majority of our population, those who are fully vaccinated and boosted have approximately a 3-time higher risk of, or they have, the ones who are not vaccinated have a 3-time higher risk of testing positive and also a 20-time higher risk of dying from COVID. So, and I think I know there are challenges around getting the boosters, not only for some, current residents, short stay residents, but also even if they're not 65 and older, because they do work with that population. We really do encourage you to encourage your staff to get their vaccines, get their boosters. And I know with this new variant that came through, it's really a challenge for everybody, because even some vaccinated people are getting testing positive and having some mild symptoms from that, or those who are unvaccinated. Some might only be having mild symptoms, but overall, those who are unvaccinated have worse symptoms. So that's why the vaccines and the boosters are really important for everybody. So the expectation is that, we're probably in that time frame where most skilled nursing facility residents are eligible to have their second additional booster. And then, you're going to need to do, again, that additional education and support. Now, Department of Health does have support available. So if on their website, the Department of Health website, if you need help identifying a pharmacy provider to host an on-site booster dose clinic, there's a survey that you could fill out and they'll help you with identifying that pharmacy provider. I don't think that's a huge issue in our state. And then also you can reach out to us at Quality Insights if you're having issues with vaccine clinics, and let us know what your issues are, and we'll see what we can help you with. And then Department of Health also has a variety of resources that are available. There are links if you need additional support, if you need test kit ordering, infection control resources. So they are there for that support. And I know that they appreciate, the partnership that all of you have with them. And as I know, Quality Insights appreciates what you do every day for protecting your residents, especially from COVID-19. So the second booster is absolutely something that you want to work on. We would be some of you may know, if your booster rates are not as high as what they should be, you've heard from us here at Quality Insights, reaching out to you to ask you, what are your booster rates? What are some of the challenges and barriers that you're coming up against? And we're very interested in hearing that, because we want to develop resources and education around that also to help to assist you. So we're very interested in hearing what some of those challenges might be for you. And then the last piece, and Kathy, did you want to put this up? It's the outpatient therapeutics for long-term care facilities.
Sure. Would you like me to share my screen with it?
Yeah,
okay.
You could do that.
First, you sent me a link for the second booster, so I'm going to drop that in real quick.
Okay, yes.
And I will share my screen with that form in just a moment.
And really, it's just to let you know that COVID COVID-19 therapeutics treatments are currently allocated by the Pennsylvania Department of Health. And it talks about, there are those oral antivirals, the monoclonal antibodies, and then the monoclonal for treatment, and then the monoclonal antibodies for pre-exposure prophylaxis. And there's the form. And again, this was also available off the Pennsylvania Department of Health message board, where you can pull this form out. And I like it because it has an explanation of what the antivirals are, who should get them, sort of the names of them, some information. And again, these are the treatments for those who have COVID-19. And then you look towards the bottom, how can my facility access these therapeutics? Sorry, too much talking. There is an enrollment form on Pennsylvania Department of Health website, which is included in this. You can just click on that and go right to that form. You can check to see, there's a locator tool to see if your pharmacy stocks those therapeutics. And I do have to say and I do know that, Paxlovid, there was some research being done, studies being done to watch for issues with that medication. My 83-year-old mother-in-law had a bout of COVID. She was day 2, she was getting very sick. Unfortunately, it's like it didn't get to her day 1, but day 2, she was starting to get very sick. Her doctor actually recommended the Paxlovid. We did that at home. And she really recovered quickly and had no side effects from it. So, that's a personal story. I know one person with that treatment, and honestly, with the direction that she was headed, and she had her vaccines, but the direction that she was headed, I really did see a difference in her getting that treatment. And I really do believe that it may have saved her from having to go to the hospital. So make sure that you're not forgetting that there are treatments out there, if they're necessary. You're not looking at those residents that are testing positive but they're just testing positive, but they're not having symptoms or anything like that. But these are for those who are having those moderate symptoms that they do need a treatment. So that is pretty much all of the updates that I have to share. And you have the information in chat. Something that I would like to ask from all of you is if you would, open up your chat, take a look, see where these websites are. And I would like you, if you have any questions, please chat it in, so that I can answer any questions you might have now. You can always reach out to me or your quality improvement specialist working with your nursing home at any time if you do have questions. Another thing, if you don't have questions, another thing we are very interested in is to find out if there are topics, because we're talking about COVID, we're talking about vaccination boosters. And I did want to update those of you who are on the call also. The QIO, we work with, CMS lets us know what things that they're looking at, as far as and things of interest, things that they're looking at nationally with nursing homes. And so we're really still focused on that infection control piece, especially antibiotic stewardship. So for instance, if antibiotic stewardship is something that you might be interested in having more education resources, even personal assistance from us, from our quality improvement specialists, please let us know that. And it's not just around COVID. In nursing homes, we have UTIs, we have pneumonia, there's sepsis. Sometimes we've identified some fairly high rates of sepsis in certain areas in our nursing homes from the data. And antibiotic stewardship can address all of those. And then CMS and of course Department of Health, they're all starting to look at continuing to look at, especially after COVID now, because we're sort of moving back into, I guess, normal, new normal, whatever. But now they're starting to again look at, your 30-day readmissions, your avoidable ED visits. And we know that things like they're looking at adverse drug events, again, decreasing your antipsychotic medications, anticoagulants. That's one of those areas where with the labs and getting your PTs and PTTs and making sure that, you're not missing, somebody's not missing something, that, there wasn't a hyperthrombin time that was missed before giving a dose of an anticoag. Anti-diabetics, those types of medication where you can see a few more adverse drug events. They're looking at those, and all of those, the adverse drug events, the infections, they're all related to readmissions. So those are areas that they're looking at, and we would really like to get feedback from all of you on any of those areas. And this is just for us to know how to develop resources and education for you. Those areas that you have a need for information on those topics. And moving forward too, please feel free to reach out. If you don't respond today, like I said, email us, myself, or one of our quality improvement specialists, and let us know what topics you'd like to hear about, because we're here for you. And that's the main thing that I really want to share today. So I don't know, Kathy, did you get any questions? Is there anything?
So far, I have not seen any questions, but when I wrap up, that'll be like another opportunity for people to drop in any questions. Are you done with?
Yeah, really,
yeah.
the update, that just make sure, those temporary nurse aides that you want to keep to help with your staffing, make sure that they're moving forward with getting that testing done so that they can become certified and continue to work. And then that second booster, any education or resources that you need around that to try to encourage that to happen. And I know you're all tracking, so, tracking when they're eligible to have that second booster. And then just, like I said, any other topics of interest that you might have for us, we're very interested in hearing from all of you.
Okay. Well, thanks, Penny. I've got all those links and the resources in the chat. And for those of you who are listening later to a recorded version of this webinar, either on YouTube or our podcast, I will include the links in the description of that recording. So in a minute, we will start the Q&A portion of this meeting. If you have any questions, you can enter them into the chat or the Q&A box. And while we're waiting, I'd again like to remind everyone that our webinar for next week will be on the CDC's guidance updates on the pneumococcal vaccines, and that will be next Wednesday at 2 p.m. We also host office hours live chats twice a week. If you are looking for one-on-one advice for your facility, you can pop in during our office hours and shoot us a message, and someone will be there to answer your questions. Those are every Tuesday at 8 a.m. and every Thursday at 2 p.m. And you can find the links to those live chats and our webinars in the newsletter we send out each Friday called the Last Minute Lowdown. And if you would like to receive that newsletter, but don't think you're on our mailing list yet, you can email me and I will get you on that list. And I will drop my email in the chat shortly so you can have that on hand. And you can also email me if you would like a recording of today's webinar. And let's just take one more moment, Penny, to see if we have any questions and to drop in my own email into the chat for those who need it. I also already put Penny's email in the chat in case you have webinar topic ideas that you would like us to address in the future. And I do not see any questions right now in the chat. So I believe that we are done for today. And if it's all right, I'll just wrap this up real quick. Do you have anything else to say, Penny?
Just to thank everybody for attending and again, for all that you do for your residents. We do appreciate it.
All right. Okay, so as I said, I put Penny's information in the chat. If you would like to contact her directly, you can reach her at 1-800-642-8686 and enter extension 7636. And you can also email her at Pimes, P-I-M-E-S, at qualityinsights.org. And you can check out our other interviews by visiting qualityinsights.org/QIN/multimedia. And I would like to thank you all for joining us today. And thank you, Penny, for joining us.
Thank you. Bye.